Hey everyone, today I'll be talking about anatomy of liver in brief. Liver is a large and solid organ situated in the right upper quadrant of the abdominal cavity. The liver occupies the right hypochondrium, greater part of the epigastrium, and the left hypochondrium up to the left lateral line. The liver has 5 surfaces, which include the anterior surface, the posterior surface, the superior surface, the inferior surface, and the right surface. Borders of liver include the following. The first border is the inferior border. Anteriorly, it separates the anterior surface from the inferior surface, and laterally, it separates the right surface from the inferior surface. The second border is the anterior border. The anterior border is marked by an interlobar notch, or say the notch for ligamentum teres, and a cystic notch for the fundus of the gallbladder. The liver is divided in right and left lobes, as you can see in this diagram above. The liver is divided into the right and the left lobes by first attachment of the falciform ligament anteriorly and superiorly, second by fissure for ligamentum teres inferiorly, and thirdly by fissure for ligamentum venosum posteriorly. Also, the liver is divided into caudate and the quadrate lobe, as you can see in this diagram. The caudate lobe is present on the posterior surface. It is bounded on the right side by the groove for inferior vena cava, on the left side by the fissure for ligamentum venosum, and inferiorly by the porta hepatis. The portal vein, the hepatic artery, and the hepatic plexus of nerves enter the liver through the porta hepatis, and the right and the left hepatic ducts and a few lymphatics leave through it. The quadrate lobe is present on the inferior surface. It is bounded on the right side by the fossa for gallbladder, on the left side by fissure for ligamentum teres, anteriorly by the inferior border and posteriorly by the porta hepatis. This diagram over here shows the falciform ligament, the fissure for ligamentum venosum, and the ligamentum teres. Just a few points on some features of the liver. Most of the liver is covered by the peritoneum. Areas not covered by the peritoneum include the bare area. The bare area is present on the posterior surface of the right lobe. Next area which is not covered by peritoneum is the groove for the inferior vena cava. The groove for the inferior vena cava is also present on the posterior surface of the right lobe. The third area which is not covered by peritoneum is the fossa for the gallbladder. The fossa for gallbladder is present on the inferior surface of the right lobe. And the fourth area which is not covered by the peritoneum is the fissure for attachment of ligamentum venosum. You can see the areas not covered by the peritoneum in this diagram. This diagram over here shows some visceral connections of the liver, particularly of the inferior surface, which includes the esophageal impression, the gastric area, the colic impression, the duodenal impression, the right renal impression, and the right suprarenal impression. Talking about the blood supply of liver. Liver has a dual arterial supply. It receives 20% of its arterial supply from the hepatic artery and the remaining 80% from the portal vein. Talking about the venous drainage of the liver. The hepatic sinusoids drain into the interlobular veins, which joins to form the sublobular veins, which in turn join to form the hepatic veins, which drains directly into the inferior vena cava. The liver receives its nerve supply from the hepatic plexus. Talking about the lymphatic drainage of liver. The superficial lymphatics of the liver terminate into the following nodes, which include the caval, the hepatic, the paracardial, and the celiac lymph nodes. The deep lymphatics terminate into the nodes around the inferior vena cava and some hepatic nodes. So this was all about anatomy of liver in brief. Here is the overview of what I have discussed. If you think this video was helpful, do like this video, share this video, and subscribe to my channel. Thank you.